Hello everyone, my name is Dr. Azzuddin Ali and I'm an Associate Professor at the College of Education, Florida A&M University, and welcome at the Sunshine States, Florida. I'm going to start talk a little bit about the research or introduce the research. So this research is about, the title is about the effects of joint sports injury on college students. This research is for as a presentation at the 8th International Conference on Health, Wellness and Society. And this research, it's a virtual presentation at the conference. And this conference this year is focused on health and wellness and the speed of life at the Imperial College, London, United Kingdom. This is a non-funding research, and through the finding we will determine the injury program for each student athlete. And after evaluating the subject, we're going to use pre and post test. We will see much healthier athletes as a result of proper nutrition, training, and the use of proper body mechanism with the special healing exercise. The goal also for this research is to obtain the most efficient regime that will keep the athletes healthier and stronger without their sports throughout their sports tenure. And I mean by tenure here is the next 5 or 10 years, or maybe sometimes after the college level too. So we have a control or injury prevention training group, and we're going to select about 25 subject or student athletes, and we will select them randomly between all the other enrolled students athlete at Florida A&M University, and we consider Florida A&M University it's an NCAA D1 university. All the subjects will receive the same standard during the initial evaluation to determine any problematic joints area. So the initial injury prevention evaluation will consist of a passive and an active range of motion assessments of shoulder, ankle, and knee and elbow. And we're going to use electronic goniometers. So also we're going to use something called manual muscle testing. So the manual muscle testing, all the joints, supporting muscles. So we're going to use that test to help us with all the joints supporting the muscle to check for weaknesses. And then all the athletes will be evaluated with an overhead squat test and to determine overactive or underactive anatomy and the athlete's joints. So all the data will be recorded. We're going to keep them in file to determine the best injury prevention program for those student athletes. So all the empirical findings will be gathered to create a very important step in this research, and this is a unique thing, and actually that will be the future of the rehab or the prevention, which is creating a program. It's called home exercise program, or HEP, to strengthen condition to all the problematics area to those student athletes. So the research will capture a video also, like in about 6 to 8 weeks, of the students athletes demonstrating the correct mechanics and repetitions and the sequence of those exercises too. And after 4 to 6 weeks, all the athletes will be re-evaluated again and compare to the initial evaluation from the beginning to determine the athletics progressions. We're going to have 2 trials, and we will conduct those 2 trials during the research period. But the first trial, we will determine the current functional capacity by prescribing home exercise program. And the second trial, we will measure the results and the progression from this 4 to 6 weeks program. The HEP and the home exercise program will consist of nutritional guidance, stability exercises, and balance training for tested joints with all of those abnormal findings in the research tests. So the researcher also will use a unique piece, a new technology piece or device. We call that device Dolphin Neurostim. Then the Dolphin Neurostims looks like exactly what's in this picture here on the screen. So this is the two devices. Then we can connect them to the main tissue at the end of the device, and that can record the outcomes and the data. And so we're gonna test different, so those different points of pain on the athlete's body to treat those chronic or those soft tissue, and those really important. So when those athletes they have pain on those soft tissues, then we can record that too. Or scars. So and by applying, this is very important, step 2, by applying concentrated microcurrent impulses, why then we can trigger those motor and we can capture those different points in the athlete's muscles or body, and actually that will provide a quick and effectiveness pain relief for a long list medical conditions, as well as rebounder fitness to test the ability to jump and do something called vertical movement. In addition, the researcher will use a group of goniometers to test the range of motion for each joint, starting from the shoulder, the knee range of motion, the ankle range of motions, and then all those measurements, and we're going to have a pre and post test. Then we can actually create the home exercise program. So in this research, we have a specific keyword. Those specific keywords are athletes' health, sports career, college sports, wellness, sports injury, and preventions. So again, at the end of our title or our topic is, so we are trying to study the effects of joint sports injury on college student athletes, and then we can have a better future for our student athletes with less injury and more prevention and care. Thank you.